Hi guys, I'm Julia, and today I'm going to talk to you about a disease known as lymphedema, which is the swelling of the lymph nodes. And I'm going to specifically touch base on breast cancer-induced lymphedema, which occurs whenever someone undergoes either a lumpectomy or mastectomy and has their lymph nodes removed or they're severely damaged. So to understand how lymphedema occurs, you need to really know the lymphatic system, which there is a fluid called interstitial fluid, which is distributed throughout our bodies, and the excess fluid will go through into our lymph nodes. And our lymph nodes act as a filtering system, and they'll filter out proteins and bacteria, debris, and any of those more larger particles. Now what happens is it's hard process to drain out the lymph nodes. There's only one exit, so whenever these lymph nodes are removed or damaged, it can cause a buildup of that fluid, which is how that swelling occurs throughout the arm. Now there's multiple treatments for lymphedema to try to maintain that arm swelling and inflammation. There is no cure, unfortunately, but there have been studied multiple treatments that decrease the limb volume and can help maintain that swelling. So first I'm going to talk about compression, which is the first treatment that is most commonly used. It involves wearing a sleeve that starts up at the humeral head, goes all the way down to about the metacarpals, and then you can even get a glove that goes and reaches up to the middle phalanges. This compression sleeve is fitted for each individual person excuse me, with lymphedema, and it helps break up the fluid that is built up in the arm. It increases muscle resistance, which is how that fluid is actually pumped out throughout the arm to the rest of the body, and it encourages lymphatic drainage. So that muscle sleeve is a very good treatment for lymphedema and trying to decrease limb volume. There's also pneumatic therapy, which is kind of the same idea, but instead of wearing a sleeve 24/7, you can have a pump that you use for about 2 hours a day. There's a multi or single chambered pumps. You stick your arm into an inflatable sleeve and it'll inflate and do various pressure and massages of the arm and breaks up that fluid, increases that muscle resistance, and pushes the interstitial fluid out and distributes throughout the rest of the body. Another type of therapy is called MLD, which is manual lymphatic drainage. And what this is, is usually done by a trained professional, where you encourage a different type of massaging. It starts up actually adjacent to the affected area, so you'll massage around the clavicle area, go to the root limb, which is right around the humeral, and then go down to about the carpal area and around the hand and the phalanges, back up to the humeral area, and this is breaking up that fluid. It's increasing muscle resistance and is pushing that interstitial fluid out. So all of these treatments kind of had the same idea. There's also exercise that can be done, which are given by the therapist to the individual. Yoga has been proven to really help with lymphedema. The stretching that happens in different yoga techniques really break up that fluid and increase that muscle resistance to distribute that interstitial fluid throughout the body. Last but not least, skincare is very important. So since somebody with lymphedema might have a lot of swelling, it's really stretching out that skin, which can make it more susceptible to breakage, which makes it even more susceptible to infection. Now, since your immune system isn't going to be working as well, having some of the lymph nodes removed or damaged, it's very important to be really proactive with skincare and trying to prevent any type of infectious disease from occurring by really applying some sort of moisturizer to the arm in the infected area as much as possible, especially during the winter months. Whenever it's dry, someone might get dry skin more often. You don't want to get dry skin, whenever you have lymphedema, because it really can make you more prone to get some sort of infectious disease. So that's really all I have to talk about today. To kind of conclude everything, I talked about lymphedema and different treatments that occur to try to help swelling. It is recommended to perform these treatments together, so wear the sleeve, do the manual lymph drainage, and also perform exercises and skincare. So it's called combination therapy, combining the different therapies together. That's very much recommended, and it helps a lot with decreasing lymph volume. That's all I have to say. I hope you learned something new today about lymphedema, and thanks for listening.